ArchBridge using the CombiGuide fiducial. Dr. Isaac Tawil is a long-term KOL, completed many cases with us through this process, and Doctor is owner and director of Advanced Implant Education, and you can travel to their facility in Tijuana and perform these surgeries, and of course the restorative part as well for in-office printing. This process is a little unique in that you are using the fiducial based on the fixation base of our CombiGuide. So this can either be the metal or the plastic. Now the metal is going to be a lot easier to scan than the plastic. And in this case, this is a metal guide that's used to give bone reduction and osteotomy guidance. So let's just go through the flow. The pin guide seats the fixation base and then it's removed. Once it's removed, then you will take an iOS scan. We have these little scans here where we're going to be scanning through the process. You will scan the teeth and you'll pick up the fixation base. That's how the fixation base becomes the fiducial. Then you will extract the teeth. And in this case, it was an FP1 case, but this could be FP3 or FP1. Use the osteotomy guide, get all the implants in place, put the MUAs in, and then scan the ArchBridge scan bodies, and then pick up the fixation base all in the same scan. That is our bite. That's how the bite's preserved. Then the fixation base is removed, and then perform suturing around the healing caps, and then scan again. And you can scan either the healing collars or the multi-unit abutments. We do prefer that you scan the healing collars. And then we will, in 1 hour, design the prosthesis, print it in office, and then print and then seat either that day or the next day. So that is the CombiGuide protocol, and it's a fantastic approach. And if you have facial scanning, you can also send that to us, and we can really idealize tooth position in the face, right? Yes, we can. CombiGuide and ArchBridge. When you want to go to final, there are two great avenues. On the left is the patented iJig, where you simply capture intraoral scans, extraoral scans, pretty simple process. We send you back a prototype for the final that is sectioned and that is simply luted in the mouth, equilibrated, and returned to the lab to go to final. Very simple process, thousands and thousands of those completed. Or to the right, Graphenano. Simply scan the healed tissue and scan the equilibrated prosthesis from the day of surgery, order a prototype, or go directly to final in milled Graphenano material. Two great options to finish up your case without the need for photogrammetry.